Good afternoon, everyone. My name is Carol Rawson, and I serve as the chairperson of the Dystonia Advocacy Network, also known as the DAN. This is my first year in this role. I also serve as vice president for public policy for the Dystonia Medical Research Foundation. It's my great pleasure to welcome you here today. I have dystonia and have had it since I was a child. At the age of 10, I was no longer to write with either hand. 5 years later, my father, at the age of 53, and I were both diagnosed with focal dystonia. My sister, her son, and my daughter were later given the same diagnosis. Unlike the other family members, with every passing year, my daughter's dystonia got worse, spreading to other regions of her body. By the age of 19, she was unable to walk or feed herself. Later that year, she underwent deep brain stimulation surgery, and thankfully, she was able to graduate from college and to go on to live a relatively normal and active life. Next slide. I believe it is important for all of us to do as much as we can to support dystonia research. I have participated in numerous clinical trials at the NIH and have been a longtime dystonia advocate. It is my honor to serve as the chair and to be part of this with you, and I know we will be successful this year. Thank you for your willingness to share your story. By telling your story, our legislators will better understand what dystonia is and how it changes lives. You do not need to be an expert on legislation or the legislative process, only on your personal experience with dystonia and how it has affected your life. Your story is what makes all the difference. The stories we will share are what the members of Congress and their staff will remember. The program this afternoon is designed to give you a brief overview of how things work in Washington, and then focus on what we will be asking of members of Congress, and later provide you with an opportunity for questions. This webinar is being recorded, so others who are not able to join with us will have it as a reference, but it will also be available for you if you want to view it again. We will send out an email with a link as soon as it is ready. Phil Googlis of the Health and Medicine Council of Washington will be our primary speaker today. He will provide the overview of the issues we are asking Congress to help us with this year. Janet Heischutter of the Dystonia Medical Research Foundation will also provide information on how we will get you what you need to send to your members and follow up, and she will moderate your questions at the end. As many of you know, the DAN is a collaborative effort of 4 dystonia patient groups working together to meet the legislative needs of the dystonia community. I can't tell you how great it is to work with the other organizational members of the DAN, the Benign Essential Blepharospasm Foundation, the Dystonia Medical Research Foundation, the National Spasmodic Dysphonia Association, and the National Spasmodic Torticollis Association. I want to take a minute to acknowledge the important support the DAN received from Allergan, an AbbVie company, to help us with this program this year. We are grateful to Allergan for their support of this important program. For more than 15 years, dystonia patient organizations have been working together to make sure our elected officials know what dystonia is and how it changes lives. We are stronger together, and we have a demonstrated history of success. It is now my pleasure to turn the program over to Phil Googlis, Vice President of the Health and Medicine Council and the primary contact for the DAN. Please feel free to use either the Q&A box or the chat for your questions. They will be answered at the end. Take it away, Phil.
Thank you, Carol. Thank you, Janet, and thank you, everybody, for joining us today. It's a pleasure to be with many of you again. I've had the privilege to have gotten to know many of you over the many years of working with the Dystonia Advocacy Network and with you here in Washington, D.C. Today, just want to start by going over a quick overview of the three branches of government. You have the executive branch, which is the administration. They enforce the laws. You have the judicial branch, which is the courts. They interpret the laws. And then you have the legislative branch, which is Congress, and they are the ones who create and enact laws and specific policies. The reason why we focus our advocacy with Congress is because the authority that they have. Congress has the power of the purse. They decide how much each federal agency receives in funding on an annual basis. They decide what policies are crafted, advanced through the legislative process, and turned into law. And they have key oversight over federal agencies that we engage with that help to advance the priorities of our communities. First, a quick review of the Senate. The Senate is composed of 100 senators, 2 from each state. Each senator is elected to a 6-year term. It doesn't matter if you live in a high population state like California or a smaller population state such as Delaware or Montana, you have the same amount of senators, which is 2. The House of Representatives, on the other hand, each member of the House is elected to a 2-year term. You have 1 representative from every single district, and there are 435 members of that House in total. Those members are based off of populations of a state. So again, high population states like California have about 53 members of the House of Representatives, while smaller states such as Montana, the Dakotas, or Delaware only have 1 member of the House. Now, to help prepare you for our Advocacy Day, we want to talk about how to make dystonia personal. We implore you to keep it simple and concise when crafting your story. Share your experience. As Carol mentioned, you do not have to be an expert in the policy or the specifics of what we are requesting. That's what I'm here for, and that's what the information that is provided for you is there for. What you are an expert in, first and foremost, is your experience and your story. What has your journey been? What challenges have you faced? What do you want the staffers of your members of Congress to know about your experiences that makes them support our priorities? Going back to Congress, I want to talk about some key committees that we work with. On the Senate side, you have the Appropriations Committee, which is the committee that decides how much money is spent at each federal agency. Each year, they come together to fund federal agencies through different bills. You also have the Health, Education, Labor, and Pensions Committee, which is the HELP Committee. They have specific oversight over key federal healthcare agencies such as NIH and CDC. They also have the oversight. Just today, they had the hearing for the new nominee for the Secretary of HHS. So the HELP Committee has a very important role in crafting healthcare policies. You also have the Finance Committee, which oversees the Centers for Medicare and Medicaid Services, both Medicare and Medicaid, as well as chief tax writing issues. They also have a very important role in the overall healthcare system. On the House side, you have complements to the Senate committees. The Appropriations Committee on the House side serves the same role as the Senate. They're the ones who decide how much money is funded at each federal agency. You then have the Energy and Commerce Committee, which is the complement to the HELP Committee. They have oversight over federal healthcare agencies such as CDC, NIH, FDA, and they cover any number of healthcare policies that affect our communities. The Ways and Means Committee is the complement to the Finance Committee, which has oversight over CMS, both the Medicare and Medicaid programs, tax issues, and some other high-arching and high-priority healthcare issues. Now, some of those key federal healthcare agencies that I've been mentioning. First is the National Institutes of Health, NIH. NIH is the foremost scientific research agency in our country. They fund medical research into any number of conditions. Specifically on dystonia funding, we're up to about $19 million that's funded through the National Institutes of Health. And that is critical because they do basic science research that helps us better understand forms of dystonia, causes, and can lead to therapies. You then have the Centers for Disease Control and Prevention, the CDC. They're the agency that's tasked with taking the key findings and the key discoveries from NIH and sharing that with the public. They provide education for doctors, providers, as well as different awareness campaigns for the communities. You then have the Food and Drug Administration, which oversees therapies and approvals. And then you have the Centers for Medicare and Medicaid Services that decide specific policies, not only for those recipients of those two programs, but decisions made by CMS also has an effect on private insurance as well. So now I want to talk about how to find your senators. To find your US senators, first you're going to go to the website www.senate.gov. You're going to conduct a search using the Find Your Senators pull-down menu on the upper right-hand corner. Again, you're just going to look for your state. You have 2 senators from your state. On the results page, there's going to be a link to the senator's website, their contact information, and other key things for you. Here's an example of Senator Durbin's website from Illinois. After going to senate.gov, you would click on Senator Durbin from Illinois. It will bring you to his homepage here, where you'll see some different options for you to explore. We encourage you, because this is a new Congress, to learn more about your representatives and your senators. Click on the About tab, find out a little bit more about them, and see what issues they care about, some committees they serve on, and get a better understanding of who they are. You will also find here, as is circled, their office locations. So we encourage you to find the office location that's closest to you. In a state like Illinois, you'll see that you have different possibilities here. You would look to find the one that is closest to you. Here it'll give you their address, their phone number, directions to them, as well as their hours of operations. We encourage you to get in touch with your local office, to engage with the local health staffer, and to begin to develop that relationship with them. Again, you'll see here different tabs that you'll be able to explore, as well as different ways to follow your member on social media, so that way you stay up to date on things that they're doing. Now, to find your member of the House, it's a very similar process. First, you're going to go to www.house.gov. This time, though, you're going to use your zip code to conduct your search, because it is different for the senators, where they cover the whole state. Your House member represents a specific district. So you're going to want to put in your zip code in the zip code search box in the upper right-hand corner. You're going to click search, and on that search page, you're going to get a photo of your representative. Or you might be in a situation where your zip code is in more than one congressional district. There, it will ask you to put your address in, so that way they could find who exactly your member of the House is. For example, here, you'll go to find your representative, enter your zip code here, and then look up. Also, you'll see here a place where you can enter your zip code. After doing that, if your zip code was 60601, for example, it will pull up that Danny Davis is your member of Congress. It shows you a map of the district, as well as once you click on his name, it'll take you to his website. And on his website, you will have the same ability that you did with Senator Durbin's office, where you'll look to see the office location that's closest to you. Now, to contact them, we ask you to prepare for your interaction with them with the materials that are going to be provided to you. We encourage folks to call your district's representative, to call your representative's district office, again, the one that's closest to you. Ask to speak with the staffer who handles health policy, and get some information about their DC staffer. We're mainly focused on the local connection, but it's also good to have other information as well. Get the email address for the individual who works locally in the office. And then we're going to ask you to follow up with that staffer. We'll discuss a little more about the call script, the email script, and follow up a little later. So how do you prepare? For those of you who may have never advocated before, you may think, what do I do to prepare my story? And I'm sure that any advocate who is an experienced advocate who has done this before probably originally had the same question. The best way we think to prepare is to read the materials you will receive to familiarize yourself with what our requests are. We encourage you to rewatch this training video today. I know that there may be something that you pick up viewing it for a second time that you didn't the first. Make note of any questions that you have as you prepare your story. We are a resource for you. We are happy to answer any questions. We'll share some contact information with you later on to use, but feel free to use this as a resource and ask us to help as you prepare your story. Again, ask yourself, how has dystonia changed your life? What has your journey been? What has your experience been? We recommend writing your story down so that way you can keep it to 3 or 4 minutes, which would allow the staffer to ask any follow-up questions, and it keeps your story very concise. We encourage you to practice it, say it out loud as many times as you can. By doing that, you will ease your nerves and you won't feel as nervous or feel the pressure of a time constraint. The more you familiarize yourself and practice your story, the easier it will be. And again, we will provide a call and email script for you that we're going to ask you to follow. That email and phone script are going to be found on page 9 and 10 of the materials that were emailed to you. We are making some small edits that we will resend that prep packet to you, but please do look for the space where the email and the phone script is. It has all of the information that the congressional offices need to know. The one key part that we ask you to include is your story. We have an example there as well to help guide you with crafting your story that can be used as a reference. And we ask you to familiarize yourself with that prep packet, as well as the issue briefs that are included that explain a little more about the issues we're going to touch on. Now I'm going to briefly turn it over to Janet. So Janet, I think you're muted.
And I was being so clever. Thank you. My apologies, everyone. Thanks, Phil. I just want to add a couple of comments to what Phil said, and then I'll talk to you about what we're looking for after you've had this communication with your member of Congress. We're really focusing on district offices this year. The relationships that are formed between dystonia advocates and those district offices have been enormously helpful to us around things like making sure that dystonia is included on that Department of Defense list. And we're really looking to build on that this year since we're still virtual. I think all of us wish that we could be together, but we're still virtual. And so we want to make the most of that this year. We're emphasizing phone calls to these offices to make that contact, but recognizing that not everyone, people may be more comfortable actually emailing. We're happy to help you identify those local staff people who you should be emailing with if you decide you don't want to call, or if you're not as comfortable calling. We're happy to help you with that. There'll be an email address that we'll show in a minute, and you can email us and we'll make sure that we get that information to you. For those of you who have participated in Advocacy Day in the past, when we were actually in Washington, D.C., and we had these visits in person on the Hill, we generally left behind a packet of information, and we used to very cleverly call it the leave behind. We have those materials for you this year. And what we're asking you to do is to contact us to let us know that the person you spoke with wants additional information. It's certainly something that you can also offer them so that you can really focus on your story. As Carol said, you don't have to be a legislative expert. You really just need to be the expert in your own story. All of the information, all of the numbers that we're asking for, the amount that we want NIH funded at, that's all in the packet that we'll email out to you. So after you've had communication with your staff person, we want to know how the conversation went. Did they seem receptive? Were they interested? Did they ask you questions that you weren't prepared for, and we need to do some follow-up? We're happy to do that. Don't be afraid to say, I don't know. It's completely not unexpected that they might ask you a question out of left field. Who did you talk with? We'd like to know the names so that we can contact and make connections between the Washington, D.C. staffer and the local district staffer. Did you email them? Who did you email? And if you did email them, did you receive a response? So next slide. So this is the email address that we're asking you to send all of your informational requests to us using this email. We will send this to you with the final informational packet, but we want to concentrate all of the requests that we have for information in one spot. So we're asking you to use this centralized email address. I'll now turn it back to you, Phil.
Thank you, Janet. Now, just want to pivot and just give a brief Washington update about things that are happening here before we move into a discussion more in depth on the issues. So first, we are in the first session of the 117th Congress. Earlier this year, a new Congress was sworn in, a new administration was sworn in. That provides us a lot of great opportunities to engage with members, whether they be new or have been in Congress for many years. It provides us with a very natural and good opportunity to educate Congress about the important needs of our communities, as well as developing those relationships with them. Currently, we are experiencing the annual budget and appropriations activity that Congress has, and there is a continued focus on healthcare policy, which we'll discuss as well. All of these things influence our key priorities and what we're going to be asking Congress to do. So a quick review of the issues that we'll go into. First, we're going to continue to support advancing research, and that's through increased funding for the National Institutes of Health. As I mentioned earlier, they are the ones who support a lot of important research for the community, for us to understand dystonia, and for us to be able to have those critical advancements. So we're going to want to make sure that NIH continues to receive funding increases so that way they could spend more money on dystonia research. We're also going to ask Congress to ensure that dystonia is again listed as a condition eligible for study through the Department of Defense's peer-reviewed medical research program. And in terms of patient issues, we are fully supportive of efforts to limit out-of-pocket costs for the dystonia community, and we'll talk a little more about this as well. So first, NIH, a little bit of background. The funding for NIH is currently at $42.9 billion. For those of you who have participated in advocacy activities over the past few years, you'll see that that number has dramatically grown over the past few years. We have been very successful with the larger patient community in increasing the overall budget for NIH. And why, again, that's important is because NIH coordinates the Federal Dystonia Research Portfolio through a number of different institutes. Don't worry about any of those acronyms. Those are just examples of key institutes that provide important research funding for the dystonia community. For the Department of Defense, many of you who have not advocated with us before may ask, what does the Department of Defense have to do with dystonia research? The Department of Defense has a specific program, which is the peer-reviewed medical research program. And that program is dedicated to investing in conditions that are deemed eligible for study because of their connection to military service. Dystonia has been very fortunate over the years to be deemed eligible for study, and the funding for this program has grown dramatically. When this program first started, there was only $20 million, excuse me, only $20 million that was available for researchers to compete for grants. Over the years, that funding has dramatically increased to now where we're at $360 million that is available for researchers. Our dystonia researchers have historically performed very well in the peer-reviewed medical research program, which has led to meaningful grants that have been funded. The only way to have access to those funds is to be deemed eligible for study. And Congress is the one who decides what conditions are in there. And just because a condition is included one year does not mean they're included again the following year. So what is our request for NIH funding? We're asking Congress to provide NIH with at least $46.1 billion in FY 2022. And the reason why we're asking for that increase is, again, to ensure that there is quality funding available for our research activities, for us to continue to grow the research that's currently being done and to continue these critical advancements that we have received. We work very closely with the key institutes at NIH in making sure they understand the needs and the research priorities of our community. And with more funding, they will be able to do more in that. We also are asking that all public health programs receive meaningful increases. We again want to make sure that NIH has the most amount of funding possible to support key research priorities. For the Department of Defense, we are actively supporting Dystonia to be included in the peer review medical research program again in FY 2022. And we're asking to maintain a funding level of at least $360 million moving forward. I also want to take this opportunity while we're talking about the DoD PRMRP and thank all of you who reached out at the end of last year. During the FY 2021 appropriations cycle, we got word that on the initial list of conditions eligible for study, dystonia was not there. We quickly issued an action alert to our community asking folks to engage with their members of Congress to ask them to support dystonia in the final bill. And because of the work of our advocates, many of you who are on with us today, in the final bill that passed Congress and that was signed into law, dystonia was again included in the peer review medical research program in FY 2021. And that is a testament to all of the work that everybody in our advocacy community has done to educate their members of Congress, to engage with them, and to push the request. This doesn't happen without you. Last but not least, we are speaking about critical patient access issues that face our community. Currently, there aren't any specific bills that have been introduced, but in previous Congresses, there were specific patient access bills that limited patient out-of-pocket costs, that curbed current and future payer tactics that shift costs onto patients, step therapy, non-medical switching, copay accumulators. All of these things were parts of different bills that were in the last Congress. Because the Congress is just a few months old, it'll only be 2 months old when we have our Advocacy Day. These bills have yet to be reintroduced, but we want to make sure that offices are aware of our support of making sure that we maintain critical patient access. And what's going to be important is developing, again, those key relationships with your local office so that way, when these bills do get introduced, we can follow up with them, let them know the bill has been introduced, let them know the benefit it would be for our community, and ask for their support on that. With that, Janet, I'll turn it over to you for any questions. I thank you all again for joining us today and happy to respond to any questions.
Great, thanks, Phil. So we've received a number of questions today, and also we had a comment or a suggestion from somebody in advance of the webinar, and that was in the prep materials that we sent out to everybody for today. They thought maybe we could emphasize a little bit more the ask of the member of Congress to support including dystonia on the Department of Defense peer review medical research program. And we certainly can do that. I think that's probably one of the edits you were referencing. So we're happy to do that. And any other changes that we make after this conversation today, we'll make those edits and send out to everybody all of the materials that you'll need to begin this process. So first question, Phil, can you talk a little bit about the NIH funding and whether or not COVID funding is special funding, or is it coming out of that amount that's currently budgeted and out of the new amount that we're asking for NIH?
Sure, thanks, Janet. I will say we have been very fortunate to have such a good relationship with the NIH institutes in terms of making sure we're receiving our fair share of funding. Last year in FY 2021, there was a modest increase to NIH's funding levels. A lot of it was special COVID appropriations. The final funding figure, if you adjust to not have COVID part of that, is that $42 billion figure. because FY21 was finalized just at the end of December, there have yet to be those funding decisions made on that. But we do know that in FY20, there was about $19 million in funding that was supported at NIH, and they estimate, because they don't have some of the final answers for it yet, they estimate it'll probably be around the same in FY 2021. But of course, what we always do is ask them to increase that funding for dystonia research. They just have to be very cautious and careful to give final numbers until all of the money has been allocated and they get their piece of the overall NIH funding. For our request in FY 2022, we're asking for that $46.1 billion to be for NIH. There is no part of that funding request that has COVID money earmarked. That's just for NIH's baseline. If Congress in this fiscal year provided, let's say, $50 billion in NIH funding with COVID, we would want to make sure that there was at least $46 billion of that was flagged for NIH's programmatic levels and for their ability to spend that money across different institutes. The COVID funding would be separate from that. So in a way it has, but it hasn't influenced our requests. We want to make sure that historically Congress has supported meaningful increases to NIH. And I think because of COVID, there's even more of a greater appetite to ensure that NIH has the amount of funding that they need. But we make sure to make the separation between overall NIH funding that goes to the institutes that funds these different studies and programs versus anything that would be COVID related.
Great. And we had a number of questions about the amount of money that is actually earmarked for dystonia, whether it's out of the NIH budget or out of the Department of Defense budget. Would you explain a little bit about how that research is funding and what earmarking is?
Sure. So Congress never likes to tell, or very rarely likes to tell, federal agencies what exactly to spend money on. And as a patient community, when we advocate for robust NIH funding, many of you may have heard the saying, rising tides float all boats. There are a number of chronic disease communities that rely on NIH funding. And what we do as part of the larger patient community is we all have the same ask. So there is, doesn't matter what chronic disease organization you're with, if you're asking for NIH funding, it's for that $46.1 billion worth of funding. When Congress allocates that to NIH, they let NIH decide where to spend that money. They will provide specific funding levels for different institutes as part of that overall $46.1 billion. The National Institute of Neurological Disorders and Stroke, which is the primary institute for dystonia research, is funded at, I believe, north of 1.5, close to, if not a little above, $2 billion. So the institute director of that institute then decides how much money is going to be allocated for different research activities. Then they decide how much money they're going to put towards grants, and then there's a whole process there. For the Department of Defense, it's a little different. So the PRMRP is for select conditions. So if you're not a condition listed through the peer review medical research program, you cannot apply for funding when they release their grant opportunities. That's why it's critically important that we make that request to offices, because as I mentioned, when that program first started, I believe there was around 20 conditions and $20 million worth of funding. Now there's $360 million worth of funding, and I think there's around 35 or so conditions that are deemed eligible for study. Only those 35 conditions can apply to receive funding. And Janet, correct me if my numbers are off here, but I think that as a result of our inclusion in the peer review medical research program, I think we're north or just around 20 million. My number may be off there.
Yeah, just a little south of there, 17 million. But
so $17 million has come for our researchers just from being part of that program and having access to those grants. So Congress provides overarching funding levels, and then through internal processes, do we see where NINDS provides funding? But we have seen where Dystonia funding at NINDS has grown from $13 and $14 million a few years ago to now up to $19 million. So we are seeing, as NIH overall receives increases, more research funding being put towards dystonia.
Great. So we had a really excellent question about when are we asking people to send these emails or make these phone calls? And I think that also touches on a point. It's a little bit different this year in that we're not gathering, for those of you who have participated in Advocacy Day in the past, we really sort of all focused on one day. And then we might have issued an action alert when things were, when we needed some special attention or some action around an issue. This year, this is really designed to be a year-long plan. So we want to kick it off. It's going to launch next week on March 3rd. And we're asking you to, again, reach out to those local offices, find that health staff person, and either email them or call them with the suggested call or email scripts that are in your packets. We expect that there will be other issues that we will ask you to reach out to those people on going forward. As Phil said, we're in a new Congress and things are still sort of percolating. We know of a couple of things down the road that aren't just quite ready yet to roll out to all of our advocates. So the focus today is to just answer questions, lay out the issues that were on our legislative agenda for this year. But the real activity we're looking forward to kick off on March 3rd next week. So terrific question.
And Janet, if I could just add
please.
to that, as I mentioned, there are 435 members of the House, 100 senators. So I could, hit 535 offices and bring to them the priorities of our community and say, I want you to fund NIH at this level. I want you to include dystonia in the PRMRP. The one question I always will get is, do I have a constituent who cares about this? Do I have somebody who in my state or my district is passionate about this? So by you guys developing those key relationships, it's greatly beneficial to the work that I do here in Washington, D.C. on some of the more policy specific aspects of our advocacy. And going back to our successful action alert at the end of last year, it's because so many folks have developed those key relationships with their members of Congress that we were able to, in 3 weeks' time, issue an action alert, have enough outreach from our community to get Congress to respond positively to what we wanted and have that included in the final bill. So a very key part of advocacy is having our advocates develop those relationships and really have that ability to share this information with them. We don't view advocacy as just one day, but really throughout the year. As Janet mentioned, there will be different things that are coming up later this year. And there may be some other stuff that we don't know yet that we will have to respond to at some point. And we want to make sure that, we have those relationships developed so we can keep them updated throughout the year.
Yeah, and I would add to that, Phil, Carol touched on this a little bit earlier, that we have a demonstrated history of being successful in our advocacy. Correct me if I'm wrong, but I believe dystonia was the only condition that was added to the final list from when the preliminary list was issued in November, right?
Yeah, and that was all within, 3 to 4 weeks time that we had that and had that quick turnaround. So
yeah, so I would echo what Phil said to all of you who responded to that action alert. Thank you. It worked. It made a huge difference. So the quick question that I can respond to very easily is when can we expect to get this recording and the updates to our informational packet? So great question. We hope to get the recording of today's webinar out and posted, and we'll email you all the link, hopefully by tomorrow morning, if we're lucky, maybe sooner, and the packet will go with that. So look for that in the next 24 hours. So thanks for that question. And then Phil, another question about, does the DAN advocate for for dystonia research at the NIH? If we're asking for this huge amount of money and NIH then can divide it up among institutes how it sees fit, do we talk to NIH about how we want to see it more for dystonia?
Absolutely. And for, Janet spent 3 years as a member of the advisory council for NINDS, where she had a front row seat to some of the decisions that were made, developed key relationships with Dr. Koroshetz, who is the director of NINDS. I know that we also have had have relationships with the National Eye Institute, the National Institute on Communication and Deafness, where we're able to meet with them, discuss what priorities there are, encourage them to explore other parts of research activities. I will say one other component of the appropriations process is Congress providing specific recommendations along with their funding levels. And over the past, I want to say, at least 4 years, we have been successful to have specific dystonia recommendations, blepharospasm recommendations, and spasmodic dysphonia recommendations at all of their relevant institutes that encourages those institutes to do specific types of work, as well as report back on their progress of that. So we are very much active in meeting with those decision makers to let them know what our researchers are working on, to let them know different needs of the community, hear what they're doing with their funding. Now it's a few years ago, but there was a recent dystonia meeting that was held with key members of NIH that the Dan was critically a part of to bring folks together to see what different mechanisms were out there and how could we advance the research that's being done at NIH. So part of our year-long work is to engage with all of these federal agencies that have a hand in advancing research for our communities.
Great. And we have a question from somebody who lives in the greater Washington, D.C. metro area and wondered if, because they're so close by, wouldn't it just be better for them to actually go to the Hill and make these visits in person on the 3rd?
So I will say our office is right off of Capitol Hill. Takes me 5 minutes to walk from my office to the Senate offices. I've been working from home for almost a year now. We haven't been back in the office. We are semi-hybrid version, but a lot of members, their staffers aren't working from the Hill. They are still working remotely. And because of some recent events, the Hill is not open to anybody. So despite the fact that I have a lot of relationships with folks who have offices on the Hill, even if they're in their office, I can't get into the Capitol or any of the offices because of the pandemic and some other security related decisions that have been made. So the best way is to connect with your local office and engage with them there, and they will pass along the information to the folks who work in DC. But I would strongly advise against trying to go to the Hill offices themselves and try and see them there.
Yeah, thanks, Phil. I would add to that again, our strategy this year is to develop those relationships with the staff people in those district offices because it's worked for us. It's worked really well for us. And even if you're in the greater DC area, there are district offices in the suburbs and around. So encourage you to as Phil said, to really focus on those district offices. So we had a sort of a question suggestion. Can we inform advocates of others in their zip code or state so that the appeal will be the same? How are we addressing people from multiple people from the same district or from the same state? Or does it matter at this first time around?
So I will say the script that everybody will receive has all of the same information. So if Janet, Carol, and myself are all from the same district and I reach out at 9 a.m., Janet reaches out at 12 p.m., and Carol reaches out at 4 p.m., that is perfectly okay. Since we aren't at a place yet where we are back in person having these meetings and doing this, the outreach is going to be less in a group setting and more of individually. But what we can look at as we go back to in person is to have that, group that would then follow up with those local offices and have that in-person touch. But you don't need to worry about somebody having a different message. The only difference would be their story. But each office is going to receive the same information about all of our requests. All of our messaging is going to be uniform. So I wouldn't worry about anybody having a different message than you. And for offices, it's even better sometimes if they get 6 or 7 different calls or emails about one issue, because they keep track of how many times their office was contacted about a specific issue.
And thanks, Phil. Would you explain a little bit about the target districts, targeted areas?
So what we do every Congress is look at those 6 committees that I mentioned. On the Senate side, Appropriations, Health and Finance, and on the House side, Appropriations, Energy and Commerce, and Ways and Means. And when we craft these target districts, we look to see where we have folks that overlap. So California, because there is just a lot of House members from California, most likely will always be one of those target areas, because you can have somebody who lives in, let's say, San Diego, and their House member, Scott Peters, is a member of the Energy and Commerce Committee, and their Senator, Dianne Feinstein, is a member of the Defense Appropriations Subcommittee. So that area or that person can have outreach to their House member with regards to patient access issues, and then their senator, who has a role in crafting the Department of Defense's peer review medical research program list of eligible conditions. So our target areas look to see where we have members of those committees of jurisdiction, and where we can identify that there are a lot of those key members in different areas. Those target districts also look to see who has different roles in crafting policies that affect our community. So who are members of the Appropriations Committee that decide federal funding, who are members of those other committees of jurisdiction that decide specific healthcare policies.
Great, thank you. There was a question about, does it make a difference if everybody's using the same script? And so members of Congress are getting exactly with the difference of their personal story, but they're all getting the exact same message. Does that feel canned? I mean, is that a bad thing?
No, because as Janet mentioned, normally we have our leave behind packet when we're here in Washington, which has all of the same information, the same legislative agenda, the same fact sheets. Each office gets the same information and materials, no matter where they're from. The one thing that's always different is that patient story. And that's, of course, what's critically most important, is sharing that patient story. And it's also important that you follow up with us with who you met with and what response you got, because then what Janet, Carol, and myself will do is, go through, review that. I will, if you send an email saying I had a positive meeting with this staffer, Bob, who is in my senator's office, that gives me now the opportunity to follow up with them on some of the more specific requests. But it's important that there's consistency in what our requests of members are. And again, what really moves everybody is that personalized story. So it's perfectly okay that we have a uniform message going across Capitol Hill, and it makes it a lot easier. So that way we know that our Dystonia advocates have asked for the $46.1 billion for NIH for inclusion in the PRMRP and that important patient access issues.
Great. So there was a question about where to send questions or follow up. And again, we'll send out that centralized email to everybody, and then you'll have it. And we're asking you to let us know if if you talk to a staffer and they ask for the informational packet. This way we'll be able to track it. A report will go to Phil, so he'll know that Congressman Davis, staff person here in the district office, asked for more materials, so that when Phil in Washington is talking with Congressman Davis's health staff person, he can say, Oh, we sent it to Mary Jones in the local district because one of our advocates spoke with her. So that's why we're asking you to contact us, and then we'll send you out the packet so that we are able to track, in fact, who's requested it. There was a question about can people be told the targeted districts in each state? We will let you know if you're operating in a targeted district. For those people, if those advocates who are in certain targeted districts, we may want to work more closely with you throughout the year because your member of Congress holds a special leadership position or an advantage of somehow that could help us really implement our legislative agenda. So it's a great question. There are some states where there are no targeted districts, and that's okay. It's just for whatever reason, the elected officials from those states don't hold key positions on key committees that can be really helpful to us. So
we still will, regardless if you live in a state or a district, it's always great to develop those key relationships because a number of our champions don't really serve on key committees, but they have been very passionate about our issues, have been at the forefront of advancing our priorities because of the connection they have with constituents. I'll use Congressman Chris Smith as an example from New Jersey. Every year he stands up for the Dystonia community, sends letters to the Appropriations Committee, supports all of our requests, and really will do anything that we ask of them to do on behalf of the Dystonia community. And that's because of his relationship with the NACBARs. But he doesn't serve on any healthcare related committees. He's not an appropriator or on ENC or Ways and Means. So he wouldn't show up on a target list, but he's an example of somebody because of the local relationship that was developed. He is a strong supporter of ours and all of our priorities.
Yeah, good. Thank you. That's helpful. Also, just in the past, we have tried to feature speakers who can share information with us, like if they were funded by the National Institutes of Health, what their project, what entailed. So for this year, for our advocates, we're going to have a speaker on March 9th, Dr. David Peterson, who received one of those grants from the Department of Defense Peer Review Medical Research Program. And he's going to talk about his project and how critically important that funding was for him. So information about that webinar will be sent out to you shortly. But we wanted to just really right now just focus on today and getting everybody ready for March 3rd. That webinar will also be recorded should you have a conflict and not be able to see it. So we did get a question from somebody who tried to identify the local office close to them for one of their elected officials and was having trouble. And I'm happy to contact that person and follow up. But that's also just a message to everybody. If you have trouble, let us know. Use this email address. We're here to help you. We want you to be successful. We want you to make those connections, and we want you to really develop and nurture those relationships because we know they can be really critical, and we are completely at your disposal. So let us know. I think we might have one more question. What if you have contact information from a previous meeting, like you'd been on the Hill before? Should I email them if I can find their information again?
I would recommend still reaching out to the local office because we're in a new Congress. There's a lot of movement. There were a lot of members who retired. So their staffers might have left the Hill or moved to another office. There are a number of members that lost re-election. So their staffers, the same thing, either went to another office or left the Hill, or there are staffers who've been with members for 30 years and their boss is still there, but they've decided to move off the Hill or do something else. So, we would still recommend to reach out to the local office. It may still be the same person, and if it is, that's great. But we always want to just make sure, given the new Congress and a lot of the staff movement that occurs with new Congress.
Great, good idea. And again, we're really focusing on those local relationships. So question, approximately how long should an email be if you're emailing versus calling? just avoiding, I think everybody's suffering from lengthy emails these days. So should we follow the script? Do you have any comments on that?
So we've tried to craft the script to be short, sweet, and to the point. I think Janet is absolutely correct about, long emails and all those things. So we've tailored both the call script and the email script to be as concise but meaningful as possible. That's why we encourage you to use the sample story that's there as a guide when you craft your story that you include. So that way we make sure that the email doesn't go too long or the call doesn't go too long. But we've tried as best as we can to make sure that it's short enough, but has enough of the information that is needed for offices. And again, the main thing is getting that contact information, because this isn't the only time we're going to reach out to them. So if you're on the phone with somebody and you forgot to mention something, that's perfectly okay. If you have their contact information, we're going to follow up with them. If you sent an email and you missed a paragraph, that's perfectly okay. Share that information with us about who you spoke with, and we'll follow up with them. We want to make this as easy and seamless as possible for you. We're here to help you with that and to do the follow-up. So don't stress about it. Follow the information that we have, but I can't stress enough that be an expert in your story and then follow up with us and share the information so that way we can follow up with offices as well.
Great. And we'll reiterate, we'll get you the link to today's webinar recording. We'll get you the email address. We'll get you the final informational packet so that you have it. And then we'll get you information on the March 9th webinar with Dr. Peterson's work. We're really excited about that. So, and excited for all of you to learn about what your efforts have resulted in. It's his work is really, really innovative. So I want to thank Phil for his comments today and his support throughout the year. We're well served working with Phil and Health and Medicine Council. And thank Carol Rawson for her leadership role with the DAN. And I want to also thank the other members of the DAN Steering Committee who worked very hard to make sure that we have a really robust and responsive advocacy program. And then finally, all of you for taking the time to be with us today, for taking the time to kick this off next week. And I think as importantly, for sharing your personal stories. We appreciate that. We're asking you to share, things that are very intimate, stories about you or your loved ones. And they really, really do make a difference. We know they do because of our past experience. So thank you all for your willingness to do that. We look forward to a year of advocacy, and we're going to make things happen. And you're a part of that. So thank you everyone for joining us today, and stay tuned to your email, and we'll get you a number of things in the next 24 hours. Thanks so much, everyone.
Thank you.
Bye-bye.
Thank you.